I'm used to walking around. All right, so my name is Genevieve Cox, and I'm a sociologist. I'm a senior researcher at JG Research and Evaluation. This is Josh Revious. I'll let him introduce himself in a bit. He's the current executive director of HRDC4, which is Human Resources Development Council in Montana. It's up in Havre. And we, over the past year, the Montana Community Action Network partnered with my research organization, JG Research and Evaluation, to do a statewide community needs assessment. And it was a very collaborative process. So we're seeing this workshop presentation as sort of like those of you that are wanting to do this in your own states, you're thinking you're going to be doing it in North Dakota soon. Is anyone else thinking about doing a statewide community needs assessment? Okay, what state? Wyoming. Okay, great. Okay, great. Well, maybe this will be instructive, our like lessons learned and what might work or might not work for you. So Katie McLain is the executive director of the Montana Community Action Network. And like I said, I'm a senior researcher at JG. This was the team, and then we have 20 people, I'll get back to this, 20 people who work at JG Research, and we do work all over the country. Some of us, like I used to be at Montana State University and got recruited to leave academia, go into research, but we do all kinds of different types of things around the nation. So Katie and Josh did a bunch of work in the years leading up to this community needs assessment, the statewide community needs assessment. He was in AmeriCorps Vista and did quite a bit of the pre-work. So that's why he's here. This was sort of his baby, an idea. Could you hand out, I made 50 copies, maybe went a little overboard. So I just want us to think a little bit about, he's handing out a worksheet to start. If you'll take just like 5-10 minutes to look over the current process section to think about where you are currently at in this process of your statewide community needs assessment. We'll talk about it a little bit, but it's more for you to have in your head as I keep going on and on about what we did, to think about what you will need to do differently or want to do differently. So I'll give you 5 minutes to kind of look over that, make any notes that you want. Okay. All right, feel free to just like keep making notes as we're going through this. But can I ask, Wyoming, where are you at in your process?
So we just finished our individual needs assessment. We haven't done the statewide needs assessment, which I never understood why for the past 7 years I've been doing this.
Okay. How many community action agencies do you have?
So technically there's only 2 community action agencies.
Oh.
There are, I want to say 12 CSBG recipients, which
Oh,
is required.
right.
Um,
Okay, so there's like 14 entities possibly that could be involved.
so like with us, we partnered with the hospital on their CNHA.
Uh-huh.
No,
Community health needs assessment? Yeah, I know what you meant.
which I know technically they're not the same. But the best part about it when we got to participate on that is we got to bring the social services aspect to the CNHA.
Aha.
So we just started that as a community collaborative.
Okay,
So I really want to go bigger. I want to go state collaborative because we are all utilizing the
sure.
same fund, especially with us in the network, the CSNO network that we are part of for the Wyoming.
Okay.
So it makes no sense to spend $5 grand each county when we can try and develop one system. And not only that, to have one system that keeps updating itself every year.
Sure.
We do it every 3 years.
Sure. So I think some of the concerns and challenges that you just brought up, Josh will speak to when he was doing his like pre-work about why Montana wanted to go that route. And it's some of the same reasons. I mean, how much do you spend on your CNA, right? It takes money, to do all the coordination. And at least from my perspective, I'm not at a community action agency. I'm a sociologist, like I said, a social researcher. But to do all of the analysis and data cleaning and data collection, it's actually quite a significant investment in time. So I hope you have some partners that can.
Well, the thing about like kind of my position a little bit is not really the aspect of that, but because I'm on the board for the CSNO network and a lot of CSB entities are on that.
Okay, what's the CSNO network?
Community Service Network of Wyoming.
Gotcha.
So this is kind of something I want to bring to my other board members to say, if we're going to be part of this network, why don't we try and do something that's actually worth
Sure.
looking into?
Great. Great. Well, it sounds like you're in the right place. So, alongside the Montana Community Action Network, the partners that we worked with were all 10 community action agencies in Montana and also DPHHS, which is like the Montana state entity. So for us, we had about the same number, and including me at JG Research, I headed up the project. So it seems about comparable. And we did, I know we have someone from North Dakota here. We looked at what they did as well in 2023. I had some changes since I'm a social researcher, and I think the person, that it was a different department that did it. So the pre-work, one could argue this was like 5 years in development, but we really just sort of accelerated it and did it from basically like June of last year to right now, and we're currently in the writing phase. So and I'll go through each stage. This is just an overview. And then one of the hardest parts that we've encountered, or that I sort of had to encounter with thinking about how to organize all of this, was who pays for it and why and how. And so we ended up having something like 14 separate contracts at my research organization to sort of account for that, because who could put in what money changed. So I'm going to let Josh talk for a few 5-10 minutes about the pre-work that he did, and then I'll get into the nitty-gritty of how we've done everything.
Thank you, Genevieve. So Joshua Revious, I'm the Executive Director of District 4 HRDC, which was one of the community action agencies you saw on that previous slide. I am also the Vice President for the Montana Community Action Network, which sounds similar to what you had there in Wyoming and what you're familiar with in North Dakota. So when I came on board, this is something that had originally gotten started in 2019, kind of got shuttered due to COVID. I came on in 2023, and we had a lot of questions that we needed to ask ourselves. I was specifically working with the Montana Community Action Network. And there was some real interest from the community action agencies across the state in having a statewide assessment. And there was also a lot of interest from the state itself for a number of reasons. And so to get started, I went to each of the agencies and I asked them, well, what are you looking for? Why do you want to do this? And, one of the first things, access to reliable data sources. Technically we're all rural, but I think some of us might be a little bit more rural than others, little bit frontier. In some of those more rural places, it can be exceptionally difficult to get your hands on reliable data. There are places in Montana that still don't have census data from the last one that was done. I don't know there's going to be something comparable in every state to, Department of Labor, and they might have really good economic data for metropolitan areas, but if you're a small town, you got nothing. And putting all that together, interestingly enough, can tend to put a little bit more pressure on those smaller community action agencies, which have access to fewer resources. Another thing that we're looking at is increased participation, and in line with that, reduce survey fatigue. So you mentioned earlier that you had partnered with a community health assessment, and I think that's spectacular. And the reason why is I don't think that the people that live in our communities necessarily know that all of these surveys are different. They ask the same questions very often, or at least close enough that it leaves some amount of consternation as to, well, why am I doing this 15-minute survey once a year without realizing, well, this one's being done by the hospital, this one's being done, so on and so forth. Participation is really difficult. Getting people to fill out surveys is really difficult. So one of the things here, clarification of dashboard purpose and reporting versus tools. What I'm kind of getting at here and how it was kind of framed initially was, what tools are we all using together and how do we get on the same page where we have the same kind of information where we can even make a dashboard without comparing apples to oranges. And that's one of the reasons why we went the style we did. And that comes down to strong interest in data uniformity. And again, that's, we want apples to apples, right? If we're all using separate data sources, they could have different levels of reliability, and when trying to clean that and bring it all together, it kind of turns into a nightmare. But once you have that data uniformity, especially in a small state like ours, population-wise of Montana, or Wyoming, you're going to have that too. It gives us the power to all come together to go for bigger funds, bigger grants that we wouldn't necessarily be able to attain singularly. This last point here has more to do with, because Montana has so many different geographical areas and so many different types of communities, what everybody seemed really interested in when I was talking to them was to have a lot of support on state-led survey distribution with a lot of on, like, boots on ground, grassroots, local outreach, for a lot of the more analytical and qualitative data portions. So some of the questions that the agencies had when looking at exploring a statewide community needs assessment, and it did require a lot of buy-in. I'm going to tell you that right now. I think probably my single greatest work wasn't doing the research on how other states was doing it. It was presenting it in a way where this looked like something that was appealing to the agencies working there. Because I mean, they kind of had an idea of what they wanted to do, but it's complex, it's difficult, it's a lot of money, and if it doesn't work out, then it's just not a great experience for anybody. So some of the questions that I went out and asked, there were a couple of trailblazers. There's North Dakota State University, which in several ways is sort of the gold standard. There was Maine. I know that. I'm sorry, I forgot your name. Yes, Logan. Stephanie, I know that you didn't raise your hand when there was discussion about approaching a statewide community needs assessment. I would argue that in many ways, Utah already does do a statewide community needs assessment, because your office specifically, you're with the state network, right? They do provide a dashboard. They provide tools. They provide, this is like a whole kit. You can walk out, you can have no idea what you're doing and walk out with a kit created by your network and come out with a fantastic assessment, because it even tells you how to do the analysis of the data that you collect. So, and that's the minimum requirement for every CSBG entity in Utah. So you're already at the point where you have, it's apples to apples there. The only component that I would say that you're missing is it's non-synchronized. So I would say that part of having a real statewide assessment is going to be capturing that snapshot in a way that you do in like a point in time survey, where you have the whole state all at once, and that way you can make really accurate and reliable comparisons across the entire state. So, right, so how are other states getting people to participate? It's gonna be, I mean, there's Facebook outreach, prizes, giveaways, what marketing or incentives work best. What we have found over our own period and the feedback that we've gotten from other entities doing a statewide assessment is it continues to be social outreach with that's incentivized through like gift cards, Visa gift cards, Amazon gift cards, whatever you have. Keeping assessments Roma-centric was a big question that a lot of the states had, but I'm sorry, a lot of the agencies had. I think that came from a good place asking the question. However, when you look at the organizational standards required by OCS in order, I'm sorry, that's the Office of what is that? No, not that one. Office of Community Services that that is responsible for the CSBG grant. So what you'll find is just constructing the assessment in a way that meets standards is already inherently Roma-centric. And then, what data sets or resources do they rely on? Again, that goes back to, it can be really hard to get information and data. So moving on to the second page there, can CNAs integrate with community health assessments? Absolutely. We chose not to go that route for what we did with our statewide, because it adds an extra layer of complication on top of something that was already in its pilot run. I would love to split this with, as a community health assessment for a lot of reasons. One of them is split the cost burden, if I'm honest, but I still think it would be a really great way to get a lot of information and have a lot of partners come together to just really deliver on, top quality data. Flyers or media to support the statewide CNA. Again, we're looking back at social media. Speaking personally as the executive director of an agency, I mean, our flyers didn't really do anything. It was email lists and it was Facebook. So here's the big question, right? What is our shared goal in this statewide effort? And I think if you can't answer that question, it's not worth going any further. And for us in Montana, it was, as we mentioned, having the ability to take one clean snapshot of the entire state, having a meaningful way how we could compare services across the state and resources, having a tool that we could go to talk to the state, foundations, other grant sources to look at and say, like, hey, like this is what's happening. And then, finally, that ability to go forward and apply for bigger grants. So some additional themes that came up while I was interviewing the agencies, and this is probably true for everybody in this room. Participation is the top challenge statewide. Survey fatigue affects both rural and urban areas. I don't know that anybody outside of Montana would call Billings a big city, but it is for us. And, it's a struggle for them. They, have a hard time getting a lot of survey participants. One thing that's really important when it comes to this work, because there was some pushback a little bit because we're so used to doing all of this on our own that it was really important for us to remember that we all work in similar domains and we're measuring the same things. So we don't really need to overcomplicate it. Rural versus urban areas, the differences and the needs are going to be real, but again, they overlap in domains that are, we can quantify that. And the feedback from the agencies before we got going is clarity, simplicity, and shared tools, just so that we could all stay on, have the same picture. So before I turn this back over to Genevieve, did anybody have any questions for me? All right, well, thank you so much.
Thanks. Okay. He also, as part of his pre-work, began to come up with some desired structures that the directors wanted. I actually didn't know any of this before I came on board. I know that he had done some work, but what Josh's role really ended up doing, at least in my estimation, was sort of consensus building, right? Like it just takes years to kind of get everyone onto similar pages. And so I felt like now we were coming in, the RFP went out, and then we at JG Research picked it up, and we thought that we also needed to build consensus to get the process going. So the RFP that they created was basically just to write the survey. We ended up taking it a lot of extra steps in different ways. But so we did a lot of document review first. I got from the state and the agencies, I got annual reports, I got the data that they'd been reporting, just to sort of better understand each of the agencies. I also, created a list of CSBG requirements and ways to meet them, possible ways to meet them. We also, me and then my co-investigator, Lisa Curry, we also met with all of the executive directors of each agency, and this step was really important. We asked about challenges that they'd had in the past. We asked about what makes their region special, because Josh and I were joking before this. I feel like part of the reason that we were hired was to like be mediators in meetings with like 14 people on Zoom, right? And it became very valuable for me to really understand all of the regions intimately, so each of the agencies and entities felt like they were valued and their voices were being heard. And so, you know, I'm not sure how it will be in your states, but that aspect of consensus building is very important to getting this done. We also, in my head, because I've done things like this before for a lot of years, I was thinking about the next steps, and I was going to be creating the survey for whoever would be doing the next steps. It wasn't necessarily going to be us, but I wanted to make sure that they knew a possible direction. So we came up with some decision points, and I'll show you the decision points that we came to that might be useful for you as well. We also developed a community needs and assets framework, meaning sort of all of the different variables and for each of the regions that should go into the CNA. We also developed sets of regional questions. This was one of the major decision points. The agencies wanted, some of them wanted to be represented with their regions in the statewide CNA, and then some of them felt like that would create more survey fatigue and that they, you know, would make the survey too long. We went ahead and wrote drafts of regional questions, and I'll show you an example of what that looks like. So as part of this process, we developed a draft of the survey. We went through a lot of review. We also, you know, for the qualitative portion of the CSBG requirements, decided that each agency would have its own focus group and thus feel more represented that way. And then we created this report that we presented to DPHHS. This was all in the fall before we actually started, before the data collection began. So these were the decision points that we came to in the like second stage of pre-work from like June of last year until November. So basically, I wanted to talk to folks and start them thinking. At JG, we do a lot of surveys. Like, what platform is the best way to collect the data? Just like very logistically focused questions. So we use Alchemer online at JG, but you know, other places use Qualtrics or SurveyMonkey. It also became apparent that we needed to keep the paper copy aspect of it. That's really central to a lot of areas, but we did, you know, we created flyers, we created QR codes, but we had to get everyone on board about what platform would be used. We also had to decide, was this going to happen at one point in time? Was the statewide survey going to happen at one point in time? Or was everybody just going to be using the same instrument at 10 different times? We also had to decide if there was going to be that regional survey component. Were there going to be customer service satisfaction questions included within that? We had to decide who were going to be the focus group participants. Everyone had to come to the same conclusion on that. Ultimately, we decided that it would be program partners and providers, not program participants, for a few reasons that I can go into if you're interested, if you have a question. And then ultimately DPHHS decided we're still going to have 10 separate CNAs, even though all of the data was going to be collected at one point in time. It's like a logistical kind of nightmare. So we decided on Alchemer and paper copies. And then I also had to think through, when you're collecting the data at one point in time, how are you going to create different data sets for each region? And who is going to do that analysis? So what we decided was that we're going to filter by zip code and by county, but we ended up ultimately just doing it by county. And then we created 10 separate data sets for all of the agencies down the line. But we also were paid to do all of the analysis of the 10 separate agencies and then the statewide at once, if that makes sense. How are you guys doing? Good, okay, cool. If you have any questions, you know, about how, feel free to jump in at any time. All right. So this is an example of I'm so used to like teaching classes and walking around and I can't. It actually this looks really simple. It actually took a long time. Could you hand out, I'm just gonna have, if you don't mind, Josh, hand out some copies of the actual survey, because that might come in handy for you all that might be writing one of your own. But as you all know, programs ebb and change from what are provided by what are implemented by the agencies. But we got lists of all of the programs that are offered by all of the agencies. We created categories of types of programs so that each of the agencies, all of the programs were categorized in the same way in case they wanted to be able to have the same kind of comparison over time for policy and whatnot. So this is what we ended up with, 10 different of these regional type questions. None of them were used. That's okay. People have them for the future. We also did some customer service satisfaction questions. So the final survey that, thank you, Josh, just handed out, we decided on 4 parts. And I want to talk through all of the questions because there was a lot of thought, a lot of debate, a lot of conversation. All of the reading is at a 5th grade reading level, the language. We also, after we had all come to all of these conclusions and we were about to disseminate the survey, then there was executive orders that came out about language, and we had to go back and really quickly change a bunch of the language, and it's fine. It's fine. we figured it out. Still happened. So the first part of the survey, we were like questions that need to be, because as you all know, people start dropping off of taking surveys as they're taking it. So you kind of want to, you always put well, not always. In survey methodology, there's a lot of good reasons to put the demographics last. So we started with the geographic location because that is what we absolutely needed in order to create these different data sets and be able to compare regionally. It includes their living situation, their role in the community, and the reason that we included, are you a client of the agency, are you a board member, are you a business owner, that kind of thing, is because I was thinking down the line for the different levels of data analysis. If we can say, if we get a representative sample of the state and we can say 20% of clients of community action agencies need this or are this, it becomes really important and valuable. So then the second part is community assets and environment framework. So as you all know, part of the CSBG requirements, you need to look at the data from a community level and also an individual and family level. So we divided them up in that way. And then the last part was the demographics. So we also added this question about American Indian reservation. It actually yielded a lot of really great data comparison down the line. This work question, we feel like is very important, especially if we're thinking about implications of policy and the narratives around working. And as you all know, low-income folks work a lot, so we wanted to make sure we could measure that. The other category also became actually very important. I went back through after we had collected all of the data and recoded all of the other responses because we found some like caregiver, right? If 5% of the people who aren't working is because they're providing full-time care for someone, that has policy implications, right? And provides some arguments for some of the work that you all do. This quality of life question, this actually, I looked at a lot of different instruments in a lot of different places, and ultimately, we decided upon these questions. We created, again, this is on the back end, we created a scale using this quality of life questions, a summative scale where we added this together, and the Cronbach's alpha is actually pretty high. And so I know that advanced statistics is not a part of the CSBG requirements, but I was just pre-thinking about what would be the most useful for all of the agencies if they have that expertise in-house. And this yielded a lot of really good data for us writing it in this way. We also had, one of the choices was rank ordering needs in the community. They could choose their top 5 needs, and then we have some open-ended questions as well, which yielded a lot of like good qualitative data to add to the narratives. The individual and family needs, North Dakota's last time was really useful. I looked at what you all had done, but we made some changes, and we grouped them all by domain that community action agencies work within. So, since we just thought that would make the most sense. But the way that we have it online is you can choose, I do not have these needs, or I do, and the rest of the questions show up only if they have the need, right? So we're also trying to think, how can we make the survey as short as possible to prevent people falling off from the survey. And then we also included at the towards the end barriers and facilitators. And some of these questions come from work that I've done in the past on community needs assessments, where I interviewed a lot of people. And in Montana, Josh might be better positioned to speak to this, but there's been a lot of closures of Office of Public Assistance. And what I've found with talking to the program participants of the agencies is they often don't know the difference between Office of Public Assistance and their community action agency. They don't know where the services are coming from. And so they're not sure where to go to get help, right? And they're applying for different programs, really not through the community action agency. And we thought it was really important to have this data to say the closure of the local state-run Office of Public Assistance made it more difficult to get services, right? And if we can say 40% of people people who took this survey say this, that's a lot of good data for a policy level. So that's why we included the barriers and facilitators. And then the last part is the demographics questions, and we've divided them up in this way very on purpose. And then the asking what is your sex, which kills me as a sociologist to say what is your sex when I really am asking about gender, but this is how we ended up having to ask the questions. And then the survey takes participants to another page so that their actual information is separate from the survey information. So I am curious, what of these questions you don't like or don't make sense to you, or you would not have on yours or have on yours, and why? Okay, yeah.
My question is, so you guys you talking about that you put it on a database as well. What database did you use as a point of collection?
Yeah, so it's called Alchemer. And so we use, I do mixed methods research, but I use the data analysis program Stata. At JG, we use R, which I don't know how to use. And at this point in my career, I'm too old to learn anything new. But we have a lot of other people so Alchemer is really good if you use R because it's very code-based and you can do a lot more in R than you can in some other data analysis programs. SurveyMonkey, has sort of you can do some analyses there, but I'll show you cleaning the data, if you're doing it from a scientific perspective, is really important. And SurveyMonkey, when you do the analysis in the data collection platform, you miss the cleaning and you miss some other things, which is why we use Alchemer. Okay.
Were you guys able to develop a method, and I kind of think of like that as trying as a board member, not as a
Sure.
agency, right?
Yep, we did that.
Collect the data that we're collecting from our counties, subsequently putting it towards the network.
Yeah. Yeah, so that was the hardest part of this whole thing. It took me, I had to sit down and figure out how to make the 14 separate contracts to make all of this work so everyone felt equitable. We also have, like, Josh's agency is fairly, and stop me if I'm talking out of turn, it's fairly small in comparison to, like, Bozeman's agency, which has a lot more money. So what we ended up doing was that the association covered, everyone threw in money for the association to cover this development that we all did together. Then, very small, I mean, we ended up at JG donating, like, some time to this, and it's okay. Like, we stand behind community action agencies, but the association paid for a very small amount for the data collection, everything at one time, and then each agency had a separate contract, and I'll show the analysis, for us to do the analysis 10 different times, and we sort of threw in the state analysis as, like, just, it's cool. So yeah, there's a way to figure it out, but the contracts are I wrote them in a very particular way. Yeah, that's a great question. So we had to talk with them a lot because we didn't want to have to put the next, and by I mean the Montana CAA Association. We didn't want to have to put out to bid since we had already put in all of this work, right? And I had already developed all of these relationships, and our research team had already developed these relationships. It was up to each agency's, like, bylaws or whatever y'all call them, about what you're allowed to do. But DPHS, it was a significant savings for us to do it at one time, right? And for us to do the analysis at one time. So it ended up, I don't know if it was a significant savings. Maybe it saved like $30,000 or $40,000. But that's significant enough that DPHS was like, okay, it doesn't have to go out to bid or whatever. Yeah. No.
But, like, between us and Casper, Laramie County and Casper is probably the largest amount.
Okay.
And then Fremont County, but the surrounding counties, we do Platte County, which Platte County I think is around 40,000.
Whoa, yeah.
We do some of Lincoln County, Lincoln County only is 21,000. So them being able to do their own needs assessment
Yeah.
is really possible for a cost center. So based on what you guys are saying, you guys look at the cost as a whole and kind of divide it by percentage of what.
Well, at JG, we bill like $125 an hour, right? So we did it by, like, number of hours of some things. But the agencies, because the most expensive part is the writing because of all the hours, so we're only writing 4 of these CNAs. The other agencies are writing their own. So you can think about it, if you think about it in stages, whatever there's the money for and the lack of expertise for, you can do that stage and then have them do the rest of it in-house. And it seemed to, like, this is the first time I've ever done a statewide community needs assessment, but I think it's going okay. Yeah, sure.
Hi, so to answer that question a little bit more, at least from my perspective, so DPHHS on top of sort of giving that RFP waiver, also kicked in about $20,000 to the Montana network. And for the portion that was paid by the network, the way that we shared that was, it's basically a percent. So we have these 10 agencies, right? And they all get a certain percentage of the CSBG that the state has. So based off of that CSBG allocation is how we decided who kind of paid how much. I don't know if that's kind of where you were going.
It makes sense, because I was looking at it 2 different ways. I do know our collecting this data or asking for this data, what is the state's participation into this and how are they buying into it?
Yeah, so I feel that the state was really interested in this because it gives them a lot of usable information because this information is publicly available, right? And besides for, I mean, they're overhauling state databases right now and kind of making it so a lot of this information can just play right into it. And I think that the state has been tremendously supportive of it. And as there are definite savings to banding together too. Despite having JG, so my agency is doing, writing. It's taking the data that JG collected and scrubbed and everything, and we're doing our own analysis, and we're writing our own assessment, mostly because we can't afford to pay them to do the remainder of it. That being said, we are still saving $9,000 compared to the previous one, which we did the whole thing ourselves. And having JG do the survey and the scrubbing and all of that, the cleaning, just was a tremendous cost saver for us. So I don't know if that kind of helps. Perfect.
Thanks, that was awesome. Yeah, it's good to have you here to answer those nitty-gritty questions. I'm just a data nerd. You know it all. That was next what I wanted to talk about if y'all had any questions about that. How are you all doing? You still interested in the next phases? Okay. It can get long in the tooth at 4 p.m. All right, so how did we collect the data and what did that look like? So it was a lot harder than I thought it was gonna be. We created, just some flyers with Canva. We had the QR code. We had a drawing for $50 gift cards. What we do at JG is we pay a social media person to I don't know what they do, and maybe it's not worth paying them, but to curate posts on the different sites. So the HRDCs that I could convince to give me their login information to Facebook, we do the advertising on their own social media. We asked folks to put it in their email signatures, to put it on their own websites, to send out, QR codes in the mail, to put QR code cards in food bank bags at farmers markets. Josh went to a lot of his constituents with iPads and had the survey there on the iPads, and people just filled it out at community events. And I'll get to the numbers. We ended up with a good response rate. It just took a lot of boots on the ground, which the HRDCs did not pay for because they did it themselves, right? They just paid for us to sort of manage all of this from the top down. We also had a version in Spanish for Spanish speakers, and make sure that I've said everything that I want to say. Oh, before we did this, we wrote up a data collection and advertising plan for all of the agencies to agree upon. So I also had all of the agencies agree to the advertising language, right? So that no one was going out and saying things on their behalf that they didn't want us to say. And then they empowered Katie, the director of the Montana Association, to sign off on any other language that we were going to say. So what were we shooting for? And then I'll show you where we got eventually. So what we did is we just did a simple sample size calculation of what we wanted to aim for each of the agencies to be able to say that we had a statistically representative sample. It's really hard to get 5,000 responses. There's there's 1 million people in the whole state of Montana, right? So we knew there was no way we were going to get to 380, 400. For some of these, the adult population's 20,000 people. It wasn't going to happen. But we shot for a 5 to 10% margin of error, 95% confidence level, and that's And that's what you did in North Dakota last time. Even at I was pretty pleased, you have university, and we were just like scrappy, and we got there, and you guys could get there if you really boots on the ground it a little bit. So the survey was open in total only for like 2 months, because in my background, I sort of believe in like hitting it hard and just like doing it rather than just like leaving it open for a lot of months. People get even more tired, I think, with that. So then how did we do the analysis? So we did it pretty quickly, because once we had it all collected, it's easy for us on the back end to do that. So we had 4,700 people take it, but part of the cleaning is that in today's day and age, there's a lot of fake bots that take surveys online. And a lot of people actually don't clean all of those out, which can really skew the sample. So we removed people that weren't in the US, we removed people who weren't in Montana, and then we removed people if they spent less than 1 minute on the survey. We left in partial responses, and I would advise that people also leave in partial responses, because we also looked at where people were dropping out. It was like at the beginning of the needs, they were like, oh, this is too much, even though the survey was like 5 to 10 minutes. So leave in partial responses. And we ended up with 3,600 responses. And we broke it down by each of the different agencies in the state of Montana. And we made it between 2 to 10% margin of error for each of the agencies, which I think is like, I was really pleased with the efforts of all of the directors getting out there and doing the data analysis. So we also we can create these like maps and different things. So as I was saying, we created individual data sets for each agency. We did that in Excel. We also had the statewide data set in Excel for folks, and in R. We can also put it, Alchemer can put it into like Stata or SPSS or SAS or whatever format you want. We also, I'll get to that. So this is where we ranked the needs, and it is not surprising actually that like housing, and a lot of the work, like I do a lot of work in substance use disorder, and people say again and again, like how am I going to stay in recovery if I don't have like stable place to live? But so what we did here with the score, these were the rankings of 1 to 5 of their community needs, and we added them up. If they put it as a 1, they got 5 points. If they put it as a 2, they got 4 points. Put it as a 3, they got 3 points, 2, and so on and so forth. And then we also who ranked it. So like 2,000 people, not only was safe and affordable housing like the most likely to be the top need, most people cited needing it. So we're able to do this kind of work with a data analysis. We also, because of the way we created those questions, is I was thinking down the line what can be used for analyses. So that quality of life scale, and I'll show how we used it. We also created on the back end people of color, non-people of color, because it provides more statistical power. And then those people that are stably housed, unstably housed, and then client status. Are they a client or not a status, or not a client? So here, basically, this is just like a simple t-test. What we can say with this is to say people on reservations are more likely to report having a lower quality of life. That actually has a lot of power, right, to be able to say to the legislature some of these things. So we put a lot of these, I can show you just like quickly what the, this is how we ended up with the analysis looking for each of the agencies by category of those questions. Let me hand it to you. So yeah, and then the writing, as we said, as part of the consensus building and buy-in, we also talk to everybody about what they thought the structure of the CNA would look like, so that those agencies that have less experience writing them had something to follow, had a blueprint to follow. So all of the different categories of what the chapters of the CNA would look like. And so again, here's our timeline. Basically 1 year, door to door. We did it, are doing it. So want to finish up by asking you all, questions like, how can we help? What kind of decision points are different for you? How can we help you think about those decision points while we're here? How would your questions be different? How would your process be different? And other questions that you have for us. Yes. I don't even know what that is. Oh, yeah, like a data dashboard. Oh, and that's called a live site too in your field. I don't know how much that would cost or who would do that. But I mean, have you considered it?
It's one of the intents of the state network to essentially host that snapshot across the state and all of the independent assessments. And it was in the works, though I'm not sure where we're sitting on it now, that our executive director for the state network would essentially make that dashboard and state assessment.
The relationship between your state, your partnership, and your state. Is there a lot of assistance help, were they able to collect data for it, help you get data?
I don't know that they were able to help us get data, but I feel like we have a very strong relationship with our state. I feel like, we strongly collaborate and we're really just partners in this. And I'm very grateful to be able to say that. I think that, the people running CSBG at the state level are actually, tremendous people and, very supportive of the work we do.
And while you guys have us, it's like free consulting. So yeah.
First of all, great information.
Oh, good. That's helpful.
North Dakota is a very rural. In 2023, our agencies provided a lot of paper surveys.
Yeah.
So, how did this translate to a paper survey? How did you collect that?
Yeah. So because we knew it would cost like $1 bajillion if we were to do it from JG's end, the agencies, we gave them the QR codes because people could just look at it on their phone and take it that way. But the individual agencies printed out their own copies of the survey and they boots on the ground it in each of the places. Once the survey gets collected, some of their sort of like junior staff or administrative staff that would might be at the front door just inputted it onto Alchemer, right? So you just do survey by survey on Alchemer and the different agencies can do it that way and it saves a lot of money. Yeah. Does that answer your question?
Yeah. Do the agencies have that capacity then?
Well, they did. So, I mean, I think Katie volunteered to help do that for people too, but that, I don't know if you all have interns or vistas or volunteers in the community that want to help in this tough time, but I'm sure volunteers could do it. You could order them pizza, turn on music. They just input the survey data into the website. Yeah, or university classes. That's a great idea. Yeah. That's a great idea. Yeah. Other questions while you we just went through this, so we're happy to.
So are you guys, if I were to talk my network in my state into doing stuff like this, what is the availability to be able to call and talk
Well, I'm sure, well, I can't speak for Josh. I'm sure Katie would speak to you. I'm happy to, like, you don't have to pay me to talk to me about if you need help. That's totally, it's the reason I work for the organization I work for is like, we're in it because we believe in the stuff. So feel free to, I'm happy to chat.
I think it's just because Montana and Wyoming are pretty similar
Yeah.
as far as the population served and frontier versus urban. And,
Yeah.
basically, that we're not a big city state, but we do have a lot of people.
Yeah, and feel free, like, we can Zoom if you, like, come across some questions. Yeah, no problem. Don't have to pay for that.
I think it's just impressive how many respondents you got.
Well, I mean, at JG, we, like, collect surveys, and we know how to pay for the marketing and do the things. It was hard work. Yeah.
Your 2-month survey, like, at what point did you get the influx?
Oh, there was, I mean, I was like emailing directors, like lists of like ideas about how to do it. Well, okay, that's a great question. So some of the agencies argued the data collection would go better in the spring because of people being out and being able to be at community events. And I think that makes sense. But I would also argue you need to think about when other people are putting out surveys, when people are at home with nothing to do. Like in Wyoming, I don't know if it's the same as Montana, but like in Montana, it's like June, July, August, go! And that's like, and then everyone's like out and then they're home.
Well, they reached that point in time now in the middle of winter. It's the most ridiculous.
Yeah. You mean the unhoused population? Yeah. Right.
I mean, Montana, South Dakota, Wyoming, these are not
No.
a good place for homeless people to be counted. And
Yeah.
as cold as it gets, you're not going to get but maybe 5 or 6 people in the whole
Right.
county. So I look at that system as a rotating system.
Yeah.
So the data that was coming from doing something like this, where we're gathering data from an actual household or actual homeless people as well, it gives us kind of a better picture of quantity data versus quality.
Yeah.
Qualitative data versus quantitative.
You got it. So, I mean, I think springtime, it seemed to work well for us. Like, we started in March, and then we ended at the beginning of May. And that's, I don't know, that time frame seemed to work.
So do you guys partner, like some of the data, do you guys use partners like the census and stuff like that to?
Well, for the, like, first part, what I've been having the folks that I'm sort of overseeing writing some of these is like Community Commons is like so easy, it puts it all together. But we also have expertise in getting census data and analyzing it. So that we divided the CNA structure up in such a way that the first chapter section is all of the secondary data, all of the census data, all of the housing and urban development data, all that is there. And then the second section we decided was just going to be the regional. So, yeah, and rather than like conflating it, or putting it together, which would be cool, this way it's just like pretty straightforward. Yeah. Yeah, and if any other questions, or feel free, here's our emails. Feel free to hit me up. I'm happy to chat for now.